So BTK inhibitors plus Venetoclax and Obinutuzumab are currently being pursued in many different studies in patients with frontline as well as relapsed CLL. In this particular study, we elected to use a non-colon BTK inhibitor, namely Pirtobrutinib, which actually was recently approved in the United States for relapsed refractory patients with CLL, and combined with Venetoclax plus Obinutuzumab as a time-limited therapy of 1 year duration as first-line therapy for patients with CLL. So we treated about 40 patients in this study, and our median follow-up is just about 1 year. And what we noted in the study is that we measured the MRD in the blood and the bone marrow by next-generation sequencing assay, which has a sensitivity of 10 to the minus 6. And when we did that assay, both in blood and bone marrow, after about 6 months of therapy, about 65% of the bone marrow samples and close to 90% of the blood samples were undetectable MRD at 10 to the minus 6, which is a very deep level of remission. And similar data, when we looked at the 1 year sample time point, we noted as well. In terms of the toxicity, we saw grade 3 or 4 neutropenia of about 60%, which is actually in line with other studies which have reported up to 50 to 55% neutropenia in this range, but notably there were very few neutropenic fever infections. So overall, we think this is a very effective regimen which will lead to deep level of remissions for patients with CLL. Currently, we are following these 40 patients, and then we also have an expansion cohort of 40 patients which we're enrolling currently, and hopefully we'll update data at a future medical meeting.